Hoping to keep its life-saving services open, a rural state line hospital announces it's looking for a financial partner with like-minded health providers to ensure continued quality care.
KSB Hospital in Dixon looks at its options to stay afloat and possibly expand. 23 News reporter Jake Pearson talks to health professionals about the importance of rural health care.
The KSB Hospital Board of Directors vote in favor of seeking financial help, saying collaboration with other healthcare systems in the last few years has been critical to expanding urgent care, wound care, and oncology.
It's really looking long term and saying, what's the best solution, if you would, for continuing to provide services in Dixon to Lee County and Southern Ogle County.
As hospitals across the country recover from the COVID-19 pandemic, one local hospital strategizes to ensure it can continue critical services to the community.
My understanding is that KSB Hospital is not going to close, but they're looking to prevent, any sort of discontinuation of services.
In a vote last Thursday, KSB Hospital in Dixon announces it's seeking potential financial partnerships.
The board took into consideration the environmental challenges of being a standalone rural hospital, the financial headwinds that healthcare across the country are facing, and basically determined that the path forward was to see whether there were affiliation or partnership opportunities.
Dr. Hannah Hinkle is the National Center for Rural Health Professions Director. She says KSB will most likely choose to merge with an existing healthcare institution to combine resources and range of coverage.
What are the financial implications and the increasing cost of care? And some of the other challenges that we see in rural healthcare in terms of, recruiting the workforce, not a unique circumstance to a lot of the hospitals that we see, even in the state or nationally, that service rural populations.
KSB says changes to the healthcare financing system and the COVID-19 pandemic has impacted the way patients use medical services, and says increased staffing and operation costs brought them to their decision to find a partner.
Thank you, Jake. And KSB Hospital was established in the late 1800s as an independent, nonprofit organization. Today, it's downtown Dixon Hospital and employs 70 practitioners and provides specialty care at 6 locations in Lee and Ogle County.